And we'll get started. Good morning. This is Alejandro with Parkinson's Point. We're working and talking with Tina Belt. She's a licensed acupuncturist, and I'll just let her take over and get it started. Thank you for joining us.
All right. Thank you so much for having me. So I have been practicing acupuncture and herbal medicine for 14 years. And today we're going to talk about whether acupuncture and herbs are effective in treatment and management of Parkinson's disease symptoms. And the short answer of that is yes. We're going to talk a little bit about, so I've got my outline here, how we diagnose in Chinese medicine, because it's different than your Western medicine diagnosis. We're going to talk about the fact that a treatment plan takes time and managing your expectations of what it looks like to have effective treatment, and integrating, talking to your doctor, because you become a middleman between the two treatments. At this point, they don't communicate as well as we would like to see, the two medicines communicate. And then I'm going to go over a really good case study that is a patient of mine that I've had a long time. And we turned around her symptoms. Her doctor was noticing the shuffling walk, and she was having difficulty signing checks. The writing was getting cramped, intention tremors when she would try to eat. And within about 6 months of treatment, her doctor said, whatever you are doing, I don't see this obvious walk anymore. Like, keep going. So that's fantastic, right? And then we'll have some Q&A. So acupuncture diagnoses people based on symptoms. It's a longevity medicine. That culture is trying to stay healthy, and they're trying to take care of themselves in a way that allows them to have a long, healthy life. And so acupuncture and herbal medicine has been practiced in China for 5,000 years. It's a continuous practice of the medicine. The textbooks that we study from are 3,000 years old. And it's the only medicine that treated every illness in China. And so symptom-based diagnosis means I don't necessarily need someone to fully develop Parkinson's and be labeled as having Parkinson's. Many of my patients, as they age, start to develop tremors. And when I treat them, it responds to treatment. And so a lot of my job is to prevent disease, to help the patient to age with a quality of life. That's usually my goal. And the acupuncture points and the treatments are determined on the symptom. So the symptoms come together to form a pattern. So I have one of my favorite textbooks, and it's called The Practice of Chinese Medicine. This is by one of the men that wrote a lot of our textbooks. And so Parkinson's actually has a section in the textbook, and there's 3 main things that create the condition. One of them is overwork and just really long days, lots of stress. One of them is poor diet, too much greasy food, fatty food, right? And obesity. And one of them is emotional stress. Okay. So these are things that contribute to the body declining. And when you look at how to treat it and you're bringing the patient in, you're also looking at the person's comfort level, right, with an alternative medicine. So some people are going to be not interested in taking herbs or supplements, right? More uncomfortable with that. And so getting over here, getting into the building, getting up on a table, being comfortable laying down and having the needles inserted and kind of taking your nap, and then being able to change or modify your diet and take your supplements, right? These are the requirements that you have in order to be successful in treatment. So if you're considering acupuncture for Parkinson's and it's for you, then you're asking yourself, can I comfortably get to this appointment, right? Can I remember to take an herbal supplement? Can I swallow? Or if you're supporting someone, like a loved one that you're thinking about bringing in, you have to think, can I bring them to these appointments? Do they need help managing that extra medication? Herbal medicines are dosed at least twice a day, so you have to take them more frequently. And this is an accumulative medicine. So what that means is when I give someone their first treatment, it's like a dose of medicine. It's like a dose of ibuprofen for pain, right? I have to repeat the treatment and see the results of the treatment frequently enough to get an effect. So the first couple treatments, the first 4 treatments might be twice a week. And then as the body starts to calm down, usually you see a change in the tremor, you see an improvement in the person's energy, and you can start to lengthen out the time between your appointments. So it's really effective if it's used well. And we diagnose using tongue and pulse, and those 2 diagnostic tools show me how the person is doing at that time of treatment. So they help me understand if when I put the needles in, the person had a good response to treatment. So when I feel your pulse, it will get stronger or it will get smoother if I'm doing a good job. So managing expectations is one of those pieces, right? Because we joke that we know people are getting better with Chinese medicine when they complain about something different. What will happen is that they get better a little at a time, very gradually. And our mind says, well, of course I'm getting better. It's a health normalizing process. So the tremors are, they're not just night and day gone, they're better, right? And they might go up and down, especially if fatigue is playing a role. Because say you have an extra doctor's appointment or you don't sleep well, you might have more symptoms that day. So progress doesn't always look like that nice, easy uphill curve that we want in our mind to see. Some days we have improvement, some days we're tired, right? So I joke that I'm trying to fill up a cup that you're drinking out of, right? And the herbs help to heal the body over time. Most of our Western medical solutions are trying to manage and increase the dopamine in the brain. What I'm trying to do is nourish and support the body to heal. And that takes a little bit more time, right? If you sometimes take like levodopa, you might notice right away there's improvement. but they'll tell you this only works for so long. And it's a manipulation of the brain chemical to increase dopamine. So in the case study I was mentioning earlier, I just called her daughter yesterday. This patient's name is Carmen, and she's 86 now. And she's been my patient for 12 years. And about 8 years ago, she started developing tremors. And like I said, her doctor was noticing the shuffling gait. She was having a difficult time eating. She was having intention tremors. And we took a formula that is for tremors in Chinese medicine. And I think I saw her every 3 weeks because she'd been a patient. And within 6 months, the doctor said, this is looking really good. I'm really happy with it. And so I called her daughter and I said, you know, I haven't asked you how she's doing lately. When she eats, does she have a hard time? Because I talked about how you get better gradually. It normalizes the body when you get acupuncture. It regulates the blood pressure and the nervous system. And it helps with the tremors or the brain fog or the function of the limbs. And she said, no, she's doing really well. She only has a tremor when she eats if she's very tired. So in her case, because she was already a patient, we kind of nipped it in the bud. Like it never got actually formally diagnosed because we caught it early and we turned it around. And now it's 8 years later, and it's in our mind as something to keep an eye on, but it's not causing her trouble. She can eat, you know, she has better quality of life due to the treatment. So I think the questions that you might have, I want to address. Talking about Chinese medicine in too much detail, I think it gets confusing, right? You know, to know that we put the needles in and they help you by connecting the brain and the nervous system to the body a little better is a kind of a nice layman's explanation, right? The needles increase blood flow and decrease inflammation and really help the brain and the body to work better together. And it's a very effective treatment for anything neurological like stroke or Bell's palsy. And it works very well for many conditions. But this is a great story of one person's journey and how it's improved her life. All right. So any questions or anything you would like me to address?
Not yet.
Not yet. I don't. Go ahead,
I have
Alejandro.
a few like baby questions. How often would somebody be seen, or how in that kind of?
So that initial assessment, I usually try to get a sense of what will work well for the patient. So some of my patients come in monthly, and I always encourage people, especially if there's a budget issue, not to be afraid to go ahead and start treatment and come in every 3 weeks or every 4 weeks, because I still believe that we're going to get a benefit over time. But if you were trying to be more optimal, you know, it would be twice a week for about 4 visits. And then we would be able to see improvement and we'd start to lengthen out. So They might come once a week for a while, and then they might be able to hold and sustain the improvement for a couple weeks. Does that make sense? Yeah.
Does Medicare cover any of it?
I wish. Medicare, there's a bill for back pain in Congress right now, right? They're trying to get it covered. So that's part of the problem, right? Is that you end up out of pocket. But some insurance covers it and some Medicare covers it. We bill just like your Western doctor, based on what we're treating. So that diagnostic ICD-10 code, what we run into is, do you have coverage for what we're treating? Do they feel that acupuncture is an effective treatment for Parkinson's? And so you have to ask them, do I have coverage for tremors? So some insurance companies are covering it, some aren't, right? And then they still don't cover the herbal medicine. And that's because they haven't finished all these studies that, you know, the FDA requires that are costly. So you end up out of pocket for the most part. But it's coming. I keep telling people, you know, 5 years from now, we'll probably see complete Medicare coverage for all conditions. That's my belief, but I'm an optimist. I always think we're going to pass this bill. We're going to get a seat at the insurance table. And that, of course, brings good and bad with it, right? Yeah, it's a problem that it hasn't fully passed. 40 years ago in this country, it was illegal to practice acupuncture. It had an 18-month jail sentence. Isn't that kind of insane to think about? And when I graduated school, I was told very specifically never chart in a Western way, because you are guilty of practicing medicine, right? Now I treat veterans through their insurance. Now they want me to chart in a Western way. They want me to administer all the Western tests, and they want me on the team, but I'm not on the team yet because of insurance, right? And they're trying very hard to fix that. I'll be letting people know how to help let your legislatures know that you want this coverage, that it's effective. In China, it's fully integrated at the hospital level. In 1970, President Nixon and his aide went to China, and his aide got appendicitis while they were there. So we learned about their medicine and they learned about our medicine in 1970. And it's fully integrated in China. And here it's just trying to get going, right? And it's being sort of picked apart by other professions. You know, you have dry needling with the physical therapists, you have chiropractors and MDs who do 100 or 200 hour classes. And what they're doing is sort of integrating it into their profession, but they don't study the full medicine. And the full medicine is amazing and powerful. And it works really well for inflammatory disease, degenerative disease, and it needs to be more fully integrated. And it's coming, but it can be a little frustrating when you want it integrated now, right? Really frustrating. There is community acupuncture clinics all over Denver. We're fortunate in Denver because there's 3 schools here. So there's a lot of acupuncturists. And if you Google acupuncture near me or community acupuncture, what you'll find are sliding scale clinics, places that don't charge quite as much, and they usually treat people in a community style setting. And they're very good. I always say we're all good people. You don't get through 3 years of a master's degree and take your board exams, and we care and we work really hard to go through the clinic and educate everybody about what we do and how effective it is. So, long answer, hopefully not too much of a soapbox for you, Brian.
It's okay.
Okay. Any other questions
What do you have to say about herbs?
about the herbal medicine? Some of my patients come in and we just do herbs. We do herbs and nutrition, and we check in about every 2 or 3 months. Herbal medicine is fantastic because you can take it every day, and it's not only management of symptoms, it's also the treatment of the root problem. So it's very good, right? And almost, if there's an affordability issue and you do well on herbs, over time, you have equal results usually to somebody that's on medication. So being diagnosed is still the starting point. You still need to do paperwork, and I need to interview you and diagnose you, decide what formula is appropriate. And then I'm trained to look at your med list, your medications, and to think about how the herbs would interact with them, and to make sure that we don't create any trouble. And, we're very accessible in if there's any change or any issues, you want to be connecting with us and having another checkup, adjusting the formulas and making sure that we're getting results.
That was a question I had as well. I recently had a blood clot, and now I'm on Pradaxa for life, which is an anticoagulant.
Right.
I had been taking melatonin to help me sleep. And then I discovered that melatonin is not compatible with Pradaxa.
Oh, you're kidding.
No, and
Yeah.
I found that on websites about melatonin, not about Pradaxa. But the medical community, at least in this country, doesn't test for herbs and their interaction with medication.
So anytime you're on several medications, there aren't actually any studies about the interactions, right? At the point that you have like 3 medications, you're going to have interactions. Does that make sense?
Yes.
And more people are on a lot of supplements. So people will bring in like their box of supplements, and I'll look at them. But the formula for Parkinson's in general does not include the blood moving herbs, right? So if somebody's on Redaxa, then you have to be careful that you're not using the herbs that would interact with it and increase, right? So what you usually want to do is just monitor it. How do you feel? Right? Any dizziness? Do you have any increase in bruising? Right.
Right.
And but the herbal medicines are pretty safe. And like I said, I've practiced a long time, and I see veterans, and they're typically on up to 14 meds. And I still use herbs, and I still do just fine with them. And several blood thinners, right? I just have to be careful that I don't use a formula that moves the blood too. There are nutritional supplements that support the brain, and there are, ways to kind of help the brain function nutritionally. So I started studying functional medicine, which is how do I think about how your body all works together? How do you digest? How's your liver function? How's your kidney function? So, I use food-based supplements too to help the brain function. And it's just realizing that the most important thing to do if you feel drawn to try it is to try it, right? Because you're clear what you want to gain from it, right? And then you kind of get together and do the intake, look at the meds and make that plan, and you start. And then I tell people, try not to get too worked up about one appointment or the first appointment. Try to commit to like 6 appointments, right? Before you make a decision. Because it's a lot of new information for your body, right? And the longer you've had something and the more severe it is, that means it takes a little while to turn it around, right? So, yeah. But it's in general, these are not formulas that are going to interact with Redaxa in a bad way. You can continue. Yeah, you can continue to take your medication. Does that make sense?
Yes.
Yeah. I didn't cover, communicating well with your doctor, right? So it can be helpful to let your doctor know I'm using acupuncture for this and I'm taking herbs. But they will often kind of plug the herbs into a database and spit it back out. Or they will tell you, I'm not comfortable, right? So some doctors actually are really negative about acupuncture. Some are very positive about it. But what you have to remember is they don't want the liability of recommending it.
Right.
And they don't study the herbal formulas. And so, often I run into that problem where the patient is put in the middle, right? And what I teach them to do is to remember your doctor is thinking about this from one way of looking at it. It's a disease, it has a treatment strategy, and they're managing your symptoms. I'm looking at it from a healing perspective. I want to improve and nourish and get the symptoms down, but I'm also trying to heal you. And so you kind of just have to remember in Colorado, an acupuncturist is what's called a secondary care provider. That means if I see any area of real concern, I'm supposed to refer you to the MD, to the doctor. And so getting just respecting, like, I like the doctor looking at you because they're making sure that there's no disease. And I like being on the team because I'm trying to turn it around, right? And so the combination is actually very good together. And what I tell people is let your doctor know what you're doing, but don't expect them to say, oh, that's great. They may not say that. And if you choose to do herbs and they're like, we're concerned about that, remember that in general, they're not trained to look at the herb and drug interactions the way that I am. And then you can always say to them, I really appreciate what you're saying. Is there something very specific that you're worried about, right? What is it that you're concerned about? And then you ask them, I'd still like to move forward with taking herbs. Would you like to monitor me? When do you want to see me again? Right? So you're being respectful to your doctor, I appreciate that you're watching out for me and making sure I don't, further have a problem. And you're also saying, I'm going to go ahead and pursue care. And when would you like to see me again to monitor things? In general, when I work with chronic disease, over time, the doctor is very happy and your appointments with that doctor decrease. So a good example of that is chronic obstructive pulmonary disease. My patient that had that, after we had worked on it for a while, her doctor stopped seeing her every 4 months. Her function improved. Her heart function improved. Her breathing function improved. And he said, I'm just going to see you once a year. Keep seeing your acupuncturist. Keep doing what you're doing. So if what we're doing is working, it shows in your labs. It shows in your function. It's very evident that we're getting somewhere and that it's improving things.
Is there any federal oversight into the strength and purity of herbs?
So the herb companies themselves monitor that. There are different standards of quality, and the formularies that generally we use here in the West do a great job. They test for heavy metal contaminants. They test the batch quality to make sure that the herbs are what they are being sold as, that they're not contaminated, that they contain the constituent parts that they should contain. And so when I use those formularies, I'm sorry, go ahead.
They're basically supplements like melatonin.
So herbal medicine, right? Typically those herbs are harvested and processed into a pill. Sometimes they're in a granular form and you make them as a tea with liquid. I tend to use a pill. There's also tinctures, which is an alcohol extract of the herb that you can take as a liquid. So that can be very effective, especially if there's any swallowing issues, phlegm in the throat, difficulty with pills, right? But in terms of the FDA, they're not directly in oversight of those formulas, but yeah.
Looks like we're running out of time here.
I think we're doing very well, but we covered everything. Did you have any more questions?
No, I was curious just to see what you had to say.
Oh, I hope that it came across well. When I went to school for this medicine, I remember thinking, what am I learning? It's a nature-based medicine. It looks at the body differently than Western medicine. Right? But it's over the years, you put that needle in and the bug bite goes down. You put that needle in and the tremors go away. And you go, wow, this is amazing. I always feel like I get to do something very wonderful. And it's an honor to get to practice this medicine. So I'm excited for it to be more integrated, right? For people to have access with the insurance. But even now, it's a powerful medicine and it's not terribly expensive, really, to help people,
Yeah.
Yeah.
Sweet.
All right. Are we out of time?
Not out of time, just if you're good or, you let me know when you feel like you've spoken your message.
Oh, I think I've covered, everything that we had set out to go over.
Yeah.
I would just encourage people to try it. And by try it, I mean, take the herbs, get, 6, probably to 12 sessions, right? and really give it time. You know, in most cases, I think we forget that it's a treatment. You know, the acupuncture itself is a treatment. And I don't think we have I think we revert to our Western mindset. We get very black and white. You know, we want tremors just gone. I think people get an expectation that it's just going to magically fix it, instead of realizing it's a treatment just like any other treatment. And then often maintenance care is about once a month. So even when I'm working on healing something, it takes a lot of damage to the nerve pathways in the brain to get Parkinson's. And you know, fixing that can take years, right, to really correct it. And the older my patients are, I call it running out a road, right? If I see somebody, the earlier I see them, the better the results, right? The more severe the disease, the more progressed the disease, the longer it takes to turn things around. And you know, I think people get in their mind that it will work faster than it does. And I think they discount how well it is working, right? Because it, you know, like the woman that I shared, we're 6 years later, she's getting older and she isn't coming in for acupuncture anymore, but she still doesn't have tremors every day. You know, she still eats. Her daughter keeps her on supplements, right? But we're not on a Parkinson's supplement at this point. We're on blood vessel and brain function supplements, which of course are going to affect and improve the Parkinson's. But you know, that's a result that's lasted and held. You know, if she had continued on without care, without acupuncture, I call it the road not taken. I can never prove what I've done. I can only say, you know, it was bad enough her doctor noticed it and now it's not there. And so it's like I prevented it, but I never get the glory of like a surgeon, right? People come in and I catch things and I fix them, but I don't, you know, necessarily have that proof that I fixed it. Does that make sense?
Yeah.
Yeah. Yeah. So I always hope people will go ahead and give it a try, because you don't actually have a whole lot of really effective options in Parkinson's, right? You know, they're always improving medication. They're always improving treatment. You know, so I don't want to assume that they haven't found something more effective, you know, but this medicine is very effective too. It just doesn't usually get, you know, tried because it's not in insurance, but that's changing. Hopefully changing soon.
Okay.
Sweet. Well, thank you, Brian and Carol, for joining us. Thank you, Tina, for speaking today. That was amazing. Appreciate you.
Oh, thank you.
Perfect. And yeah, we can conclude the session now. As always, we have our education sessions on the 4th Friday at 10:30. And if you have any questions, feel free to reach out.
All right. Thank you so much.
Thank you guys. You guys have a great weekend.
All right. Take good care of yourselves. Okay. Thank you,
Bye.
Alejandro.
Tina.
See you.